Hello friends, a very good evening. So I'm your very own mentor in pediatrics on an academy and welcome to today's session. So today is mixed bag part 2. So here we are going to discuss 10 very good basic MCQs from pediatrics in next half an hour. Okay, so it's going to be a kind of a quizathon for all of you. So looking forward. So before that, let me introduce this very good news or very good information with you that we are introducing this iconic subscription. Now what is this iconic subscription? So here in this particular type of subscription you can get both Unacademy and Prep Ladder subscription. So you all know by now that Unacademy is quite famous for its live coachings, right? We are all there for the live classes plus the batch courses, right? And along with that we keep on conducting the live tests and the quizzes. And in collaboration with Prep Ladder you can have the video lectures of Prep Ladder plus the question banks plus the rapid revision courses. So that's a fantastic offer which is coming on. Now what is it like? Okay, so to get all these benefits together with Unacademy and with the Prep Ladder, so we have to select this iconic subscription over here. So we have two options, either you can choose the plus and the other iconic subscriptions. With iconic you'll get both, that is Unacademy and Prep Ladder. So you can see the rates over here. So two things together you're getting really at a very subsidized rate. So that's almost 92, 93, 94 and 95% off. So that's a huge discount which is going on. Plus if you are using the code, the discount codes, so you're getting 10% off additionally. So that's such a fantastic thing. Now look here, if you don't want to opt for iconic, we have the pure plus subscription as well. So you can see the plus subscriptions, we have it for different duration. Again it's very less, the rates are extremely less. So you can go ahead with whatever is your choice, whether you want to choose iconic or plus. I would advise you to pick up iconic subscription because that is really something that you're getting in a platter. So looking forward to see you all on the platform of Unacademy. Also you can enjoy free live test on Unacademy NEET PG every day at 8 p.m. Okay, so don't forget to attend the live test. So it's like a very good practice sessions for all of you, as well as a step for self-analyzing. I've always tell in my to my students that self-analyzing is the key to success. If you are true to yourself, then nothing like that. Okay, so let's begin up with today's session. So you can see I've got 10 MCQs prepared for all of you. So for those whom I'm meeting for the first time, I'm Dr. Priyashree Chakraborty and I'm an educator in pediatrics and on Unacademy platform, and this is my YouTube code Dr. Priyashree-YT. Okay, so if you are taking the subscription, so don't forget to use my code because that will avail you 10% discount. Alright, so now going further ahead. Now this is ponderal index. So what is the correct formula for ponderal index? So now I can see 10 people are there in the group. Welcome all of you. Very good evening. All of you set for the quiz. If you all are ready, please give a thumbs up and we can start the discussions. Yes, so I have this ponderal index over here, the question, and the options are giving the different formulas. Can you tell me what is the correct answer to this? Very good, Priyadarshini. Yes, Abhishek. Excellent, excellent, very good. Abhishek, you want to answer? So there are 11 people now. Please answer. All of you try answering. Doesn't matter if you are wrong. I'm here. Very good. Yes, absolutely correct, Pankaj, Kanika, Abhishek. So ponderal index is the weight upon height cube. Okay, this is the answer. Now here essentially the weight is in grams and height or the length is in centimeter. What is this ponderal index used for? It is used in IUGR and it is used to differentiate between asymmetric and symmetric IUGR, right? So asymmetric IUGRs have a value of less than 2 and symmetric IUGRs will have a value of equal to or more than 2. Okay, so this is the cutoff. 2 value is the cutoff for asymmetric and symmetric IUGR. Now remember one thing, this asymmetric IUGR, the insult is already has happened mostly in the late trimesters. So they have a brain sparing effect. The brain is spared over here and the number of here the brain is also compromised. Correct? Most importantly, we have the brain is to liver size ratio. So this is more because in asymmetrical IUGR the brain is bigger or normal size, so the ratio is more than 5, and symmetrical IUGR this is again compromised, so brain is to liver size, that's the liver, L is the liver, okay, is less than 5, it is decreased. I'll just write it down so that you know brain is to liver size. Alright, got it? So this is one important point related to ponderal index. Okay, now tell me about this. Microsomia is defined as birth weight below 90th percentile, birth weight below 10th percentile, birth weight below 20th percentile and birth weight below 58th percentile. Yes, give me the answer to this. So what, this is neonatology. Microsomia is a terminology that we generally use in neonatology, correct? So today we are having neonatology. So what is the cutoffs for neonatology? Very good, I can see Sumit has given the correct answer. Yes, Priyadarshini, this is a very common confusion that is expected. Yes, I was expecting this confusion between B and C because in neonatology the cutoff is between 10th and 90th centile. Okay, whereas in pediatrics, the pediatric age group, the cutoff is 5th and 95th centile. Okay, alright. Now coming to the next important is less than 10 centile is microsomia or low for gestational age or low birth weight, and more than 90th centile is large for date babies. Also called as macrosomia. Okay, understood all of you? So now I believe there should not be any confusion, for this is the cutoff for the pediatric age group and not for neonatology. Okay, all of you understood this? Is there any confusion? Alright, now look at this image. This is actually a hymenal tag. Okay, this is the image of hymenal tag. So a hymenal tag in a newborn is best treated by steroid surgery, leaving it alone, none of the above. Yes, give me the answer to this question. Hymenal tag is best treated by steroid. Yes, absolutely correct. So hymenal tag is a manifestation in a newborn which does not require any treatment. So we just have to leave it alone. Okay, I can see some of you has marked A and B. No, surgery is definitely not required. Steroid is absolutely not an option. Okay, so we just have to leave it alone. What are the other conditions that does not require treatment in newborns? The other manifestation in a newborn which does not require treatment. The first one is the physiological weight loss. Keep answering in the dialog box. Which we expect 10% of weight loss by 3rd to 5th day, right? And by 10th day they regain their birth weight. Okay. The second is conjunctival hemorrhage. Okay. The third is a hymenal tag. I'm just writing it as HT. The fourth is vaginal bleeding. Fifth is phimosis. Okay. Now coming to the skin manifestations. So yes, I can see one of you has answered Epstein pearls. Yes, very good. So Epstein pearls, they are generally cystic swelling, mostly seen on the palate and on the glands. Okay, Epstein pearls. Then next is erythema toxicum. Then transient pustular melanosis. Then next is, yes, very good, Mongolian spot. What else? Yes, we have mentioned erythema toxicum. Milia. What is milia? So milia are plugging of the sweat glands, which we mostly see on the nose, forehead, okay, scalp. So again, that doesn't require treatment. How will you differentiate erythema toxicum with milia? So erythema toxicums are pink in color, milias are white in color. And erythema toxicums are vesicular eruptions, so they will have a sterile fluid inside with which contains eosinophils. Okay, right. And last, stalk bite, right, which is the mostly the hemangioma present on the face, on the eyelids or temporal areas, or on the forehead or scalp. So mostly these keep on increasing till 1 year of age, and by 1 year of age they start decreasing. Stalk bite. Okay, and one more, acne neonatorum. And the last is harlequin color change. So this is mostly because of the immature autonomic nervous system in the newborns, that the half side of the baby turns pale and the half is pink. Okay, so these are all the manifestations which I have written across the screen, which does not require any treatment. Okay, so we have all these manifestations. Okay, fair enough. So shall we go to the next question? All of you understood this? Okay. Now coming to some questions from hematology. Feature of fetal RBC in in adult. Alkali denaturation resistant, small in size, has more 2,3 DPG levels, more iron, wow, so that's a very good question which Harsh has posted. Is NEET PG tough or easy than UG PG, UG NEET? Harsh, see, every exam has its own challenge at that level, because at the NEET level you are more into physics, chemistry, biology, right? So question wise I cannot compare, but yes, both are challenging enough. You need to have a very clear concepts for everything. Your basics should be clarified. You need to keep on practicing more and more MCQs. So that is the trick of cracking every exam. Not only this, not only NEET PG, but also for the DM entrances or whichever entrance exams you are planning in the future. Okay, Harsh, I hope you have understood what I am trying to say. So you might have found that your UG NEET was challenging. So that was challenging at its own level. This has its own challenge at its level. Alright, now coming back to the question, I am getting a very mixed question over here. So basically, if you remember the Klehor-Bethke test, where we pick up the fetal, the neonatal blood. So most of these tests are based on the simple principle that the fetal RBCs are alkali denaturation resistant. So the answer is A. Okay. Rest, the fetal RBCs are larger than the adult RBCs. Remember, if you see the peripheral smear, they are macrocytic normochromic. Okay. So they are large in size. Their MCV is almost between 90 to 110 FL. Alright. They have less levels of 2,3-DPG. And of course they have less iron as compared to the adult hemoglobin. So my answer here would be A. Yes, very good, Priyadarshini. Alright, so now those who have marked C and D, did you understand what mistake you committed? So I have this for you all. Okay, so fetal RBC versus adult RBC, they have less 2,3-DPG, they have less iron, they are short lived, right? What is the lifespan? Up to 90 days. And adult RBC, they have a lifespan of 120 days. They are larger in size and resistant to alkali denaturation. Alright. Now coming to the next question. Okay, before going to the next question, I would like to share this very important piece of information with all of you. We all know that mostly we have adult hemoglobin, but the early phases of hematopoiesis, we have these embryonic hemoglobins, which begins which stays up to 8 weeks. After that, the fetal hemoglobin takes up the entire picture. So the embryonic hemoglobins, we have GOVR 1 and GOVR 2. Okay, now remember one thing, the main of all the embryonics, now embryonic is E. Now listen here carefully, I am telling you a trick to remember these things. Okay, now embryonic is E. So remember GOVR 1 and GOVR 2, which are very important, they will have epsilon in their picture. Okay, now GOVR 1 is 1, so it is more primitive, so that one will have zeta. Okay, zeta. Whereas GOVR 2 comes after GOVR 1, so it will have alpha. Why? Because HbA and all these major hemoglobins have alpha, so now alpha is coming over here. So alpha will come over here. Okay, so zeta 2, epsilon 2, alpha 2, epsilon 2. So 2 epsilons for GOVR 1 and GOVR 2. Understood this? Now once you remember this GOVR 1 and GOVR 2, then it's not difficult to remember H.B. Portland, where it's zeta 2 and gamma 2. Okay, zeta 2 and gamma 2. So it's half of the fetal hemoglobin. So this is coming bit later. So this gamma will come over here, the fetal hemoglobin. Alright, that's the third embryonic hemoglobin, H.B. Portland. These are the three names of embryonic hemoglobin. 1 Gover 1 and Gover 2. Then HB Portland. Okay, it's nothing to do with Portland or any place. Alright, now coming to the adult hemoglobin, we all know it's alpha 2 beta 2, which constitute about 97%. Then HbA2 is alpha 2 delta 2, which is almost around 1.5 to 3.2%. If it is more than 3.2, then we must look out for thal. So generally the thal traits have we should suspect thalassemia traits if the level goes above 3.2. and HbF is alpha 2 gamma 2. So alpha is present in all these hemoglobins. Okay, and alpha is present in only one embryonic hemoglobin, that is Gover 2. Got it? So I don't think you might be having difficulty with HbA, A2 and F. Mostly this confusion arises between these embryonic hemoglobin chains, right? So this way you can remember it quite easy. Now let's solve some question related to this. Adult hemoglobin consists of which tetramer of chain? Alpha 2 gamma 2, alpha 2 beta 2, alpha 2 epsilon 2, alpha 2 delta 2. Yes? Now give me the answer over here. I am talking about adult hemoglobin, which is HbA. So who can tell me? Very good. Yes, Pankaj, Adesh, Doc World, Harsh, Priyadarshini, please answer. Kanika. Very good. So I think most of you have understood this. It is alpha 2 beta 2. So B is the answer over here. Alright. Okay. Now hemoglobin with zeta 2 and gamma 2 are seen in which of the following? So we have zeta 2 and gamma 2. Now remember the embryonic hemoglobins which I told you. Zeta 2 and gamma 2. So how did we learn it? So these two will have epsilons. So epsilon 2, epsilon 2. So Gover 1 is having zeta and this one is having alpha, right? And here we saw that this one is having zeta 2 and gamma 2. So the answer is absolutely correct. Most of you have given the correct answer. It's Portland 2. And this was alpha 2 and gamma 2. Okay. So no point of any confusion over here. Alright. The two embryonic hemoglobins are fetal hemoglobin and Gover hemoglobin, fetal hemoglobin and Portland hemoglobin, Portland hemoglobin and HbA2, and Gover hemoglobin and Portland hemoglobin. Now please try answering this. So today we learned a very new thing, a very interesting thing, that is how to remember the chains of the hemoglobins, which are the embryonic hemoglobins. What is the difference between the fetal hemoglobin and the adult hemoglobin? Absolutely correct. Doc World and Priyadarshini has given the correct answer. So it's none other than Gover HB and Portland HB. I believe all of you have understood this now, right? Very good, Pankaj. Alright. Now look at this interesting image. A very cute image. Is the image of the age of the given child is. Now this is the child who has got a very good neck control, first of all, and no head lag. And the examiner is eliciting over here, pull to sit. Now we know that the neck control begins at what age? Yes, at what age does the neck control begin? When does the neck control begin? It begins at 3 months of age. So from the beginning ऐसा नहीं होता है कि they have a very good head control, right? So there is some element of head lag by 3 months of age, which gets very much firm by 4 months of age. So this level of neck control, actually comes by 4 months of age. Okay, and by 5 months of age, the child, when you are eliciting pull to sit, the child pulls himself to sit. So the head will be above the level of the spine. Getting it? So the answer here is 4. Absolutely correct. Very well answered. Alright. So the last question of today's session. Yes. Identify the abnormality this child is suffering from. So you can see here the options given are osteogenesis imperfecta, achondroplasia, mucopolysaccharidosis and rickets. These are all the conditions which I will be discussing on the Plus platform. How to differentiate them, how they present, and what are the basic differentiation. All these things will be discussed. What is rickets? How can you differentiate it from scurvy? And what is scurvy? What are the abnormalities you find there? What are the manifestation? Achondroplasia, MPS, everything has been discussed in details in Plus. But for now, just to give you an idea of the type of questions that are asked from these particular topics. So I can see there is a variety of answers over here, and quite to my surprise, only Priyadarshini has given, okay, even Ashwini and Doc World has given the correct answer, that is achondroplasia. Now see, the osteogenesis imperfecta, the hint will be given of a still newborn and multiple fractures. Still newborn and multiple fractures. MPS generally will be a little bit bigger babies. They will, okay, they will have very coarse faces. And they will show you, they will either they will give you this option of corneal clouding or a complete skeletal survey. Here you can see that they have not sent you a complete skeletal survey. They have just given you the pelvis. So there is a champagne glass type of a pelvis. Can you see here? It's looking like a champagne glass, isn't it? So this is a typical feature. So 3 things which are shown is a short stature, okay, with short limbs. So this is a type of disproportionate short stature. So short stature with short limbs with this type of hand is called as a trident hand. This type of hand is called as a trident hand. And the champagne glass, pelvis, this gives you a hint that this is a case of achondroplasia. Okay, and rickets, what would you find in rickets? What would you find in rickets? You will find bowing of the legs, rib notching at the ribs, right? Thoracic, either pectus excavatum or carinatum, thoracic abnormalities. So these will be the manifestation. They will be giving you the X-ray showing fraying, correct, splaying. So these are the manifestation of rickets, and not a case of not all these options. Alright, wrist widening, double malleoli, okay. So I've nothing you have. Yes, absolutely correct. That epiphyseal widening looks like wrist widening. Okay, so these are all the features of rickets. Rickets and scurvy I've taken in details in one of my topics of nutrition. So that's a completely separate entity within itself. It takes whole 1 hour of lecture. So I won't be discussing rickets today for now. But I hope you have understood that how to solve these kind of questions. Okay, you can see right from the stage of birth the child has got abnormalities. He has got a short limbs, right? So that's all for now. We have seen 10 MCQs today and how to study from these MCQs, how to retrospectively study from the MCQs. So actually this was just a brief. This is just 10% of what, not even 10%, just 1% of what we do on the Unacademy platform. And of course with the Iconic subscription, I think you are getting a huge in a platter, right? A huge of information, vast majority of information. So take my advice, don't forget to take the subscription because it will definitely help you. Alright, so with this I end my session over here. Thank you for having such a interactive session and looking forward to see you all next week, same timing. Alright, so take care. I end my session over here and stay safe all of you.